Matt Hancock insists he's committed to the NHS and credits it for saving the life of his sister, critically injured in a riding accident last year. But is he on a hiding to nothing, trying to care for an organisation many regard to be in poor health? Will it be able to cope with inevitable pressures this winter will bring, addressing the issue of low morale among staff, something he touched on in his maiden speech as Health Secretary?
It's heartbreaking to see how undervalued you often feel. The sense of duty and public service that motivates you to go into health and care is one of the things that makes the NHS the institution that it is.
Last week we filmed Matt Hancock in the neurocritical care unit at Addenbrooke's Hospital in Cambridge. Improved technology, an area he believes is vital.
I'm here looking at how the technology is making it easier for you to treat patients.
Yeah.
And really, from your point of view, does that work?
Definitely. Nursing point of view, I think it's fantastic.
The sort of news he was glad to hear. Other aspects of the job aren't quite as rosy.
He's come at a time where nursing is on its knees, and we listen to our nurses tell us every day that they work shifts short of staff and they walk away from their shifts with tasks left undone. It's really concerning. So we're at a time where all of our care services, not just the NHS but social care and care home sector, require support. They require investment around training and around workforce planning.
As for how things might improve, this advice comes from a political opponent.
At the moment, the government is not recognising the need to say to the people of this country, to level with them, we need to ask you to pay a bit more in tax to ensure that we have an efficient and effective health and care system. I favour a dedicated NHS and care tax so people could very clearly see on their pay packet how much they're paying into the system, and I think it should be informed by, every 5 years or so, an independent assessment of how much the system needs.
In the last 18 months, our mortality rate due to sepsis has fallen by 42%.
No.
Encouraging words, but he's well aware he's likely to see a lot more negative headlines than positive ones. Malcolm Robertson, ITV News.
There has been a huge amount of pressure on the health service in our region. Things like, for example, A&E. I think across our region last winter, only a single hospital met the A&E target. How do you make that different for this winter?
I want to make sure that this winter we cope with the extra pressures you get through winter as well as possible. We've put in another £400 million since I became Health Secretary in order to deal with that. Just under half of it has gone into A&E departments to make changes to how they're constructed to make them work better.
So on the targets, do you expect hospitals in our region to meet that 95% target for people waiting under 4 hours when they come to A&E? Would you expect them to achieve that for most of this winter?
I think that would be very difficult. And if they do, I will admire that enormously. But I recognise the pressure that they're under.
There's been talk about parity of esteem in mental health, yet that isn't actually happening on the ground. We know that Norfolk and Suffolk Mental Health Trust are still in special measures. We also hear, anecdotally stories about people who are having, particularly young people, who are having to travel hundreds of miles for treatment and wait months and months, even up to a year for treatment. That's not good enough, is it?
It's absolutely not good enough. And this is something I worked on as the MP for West Suffolk before I became Health Secretary, and some of the stories are truly heartbreaking. And the road to parity between mental and physical health in terms of how they're treated, that road is a long one, but I'm determined that we will walk down that road.
Your big interest is digital technology, all that kind of stuff. Last week you were at Addenbrooke's and you saw what they were doing there. They're world leaders there, aren't they, and that kind of thing. I mean, isn't it strange that still we don't have digitised notes, for example, across the whole of the NHS?
I think
and how can you tackle that?
It's completely unacceptable that there are parts of the NHS that are still on paper. And even worse is that once parts of the NHS are digitised, the care records don't always translate to a different part of the NHS, so the systems don't talk to each other. Now, we have been tackling this on the ground, in particular West Suffolk, Addenbrooke's and all the GP surgeries in that area are increasingly able to talk to each other. In fact, West Suffolk is one of the leaders in this area, and Addenbrooke's is also absolutely first rate in terms of the technology that they've got. So there is some of the most advanced technology in the world being developed in our region, and I want to get it out of those labs and into the hospitals right across the country.